Good afternoon, everyone. I'm pleased to introduce today's session where we're going to be hearing about liver cancer in 3 different countries: Vietnam, Taiwan, and Uganda. Liver cancer remains one of the major killers from cancer globally. It takes the lives of close to 500,000 people each year. I'm going to focus on what happens in the United States as a complement to the presentations that you'll be hearing in a little bit. As we think about trying to end cancer as we know it, which is one of the things that the Biden administration urgently wants to do, liver cancer falls into one of those cancers where we haven't made the kind of progress that we hope to, where only 1 in 5 patients diagnosed with liver cancer actually survives 5 years or more. Because of increased rates of liver cancer over the last few years and increased mortality as well, NCI is investing in multiple areas of liver cancer research. They include prevention, early detection, treatment, and clinical trials. And in the intramural program, the Center for Cancer Research, or CCR, there is a specific liver cancer program. There have been some noteworthy changes in the demographics in the United States over the last few years that I would like to review on the next 3 slides. First, when it comes to incidence, the incidence, particularly in males, has plateaued or potentially even gone down, and it also has plateaued among females. But if you drill down on the age-specific differences when it comes to incidence, you see that there is a major change in the individuals 50 to 64 years of age, but that the incidence continues to increase for individuals who are 65 years or older. And when you look at mortality rates also reflect that change, where Hispanics, Asian Pacific Islanders, and Blacks all have a decrease, and whites in the 50 to 64-year-old range also have it, although that's not shown on this slide. The disappointment is that American Indians and Alaskan Natives have not benefited in any way from this. We do not really understand what is accounting for these changes, and therefore it's eminently worthy of exploration. Finally, I want to mention the Louisiana Hepatitis C Elimination Plan, or Hep C Free Louisiana, where the goal is to achieve statewide elimination of infection from HCV, diagnosing 90% of those infections and treating at least 80% of them. This plan is quite successful, at least in the short term, and it's really worthwhile for us to consider whether to take such a plan nationally, because it might be able to have a dramatic impact on decreasing the prevalence of HCV infection and also decreasing incidence as a result of the decreased prevalence. So I want to go back to where I started, and thank you for listening to my introduction, and to tell you that you're going to be hearing about 3 interesting presentations in Vietnam, Taiwan, and Uganda. Thank you.